Hi, my name is Sharon Frank. I'm a speech-language pathologist specializing in vocal cord dysfunction. I am also the creator of the P.I.E Approach, which is a holistic approach to treating this very complex disorder. I've made a few videos for you to look at. One video actually there are two videos that talk about the P or the physical part of the P.I.E approach. There's one video that talks about the intellectual or the cognitive aspect of it, and then there's one video that talks about the E or the emotional aspect of the P.I.E approach. I hope that you find these videos to be helpful and informative. This video talks about the emotional aspect of the P.I.E approach, or the E part of the P.I.E approach. You know, most of the time in my experience, by the time VCD patients get to my office, they've had VCD for quite some time, and they've been to multiple providers trying to find an answer. They've maybe started with their primary care physician, maybe then they went to an asthma allergy physician or pulmonologist, maybe they've seen an ear, nose, and throat physician, maybe a cardiologist, maybe a gastroenterologist, psychologist, sports psychologist, and other providers. And they've also usually been on a variety of medications like inhalers, different medications or breathing devices, to little or no avail, so they still tend to have the VCD issues. So it's not uncommon that by the time they come to my office, they may feel a bit skeptical, stressed, frustrated, a bit desperate, but also hopeful. One of the things I really like about the emotional, the E part of the P.I.E approach, is that I really get to connect with the patient, spend the time, connect with the patient, and really listen to their story and the whole background. Because, I could have 10 patients sitting in my office, and they all could have VCD, and they may have similar physical symptoms, but that doesn't mean they all travel the same path to get here. Everyone has their own different story and set of circumstances. And so it helps me to listen to people's story, to connect with them, and to also find out more about what their sources of stress are, what their overall demeanor is like, what their coping mechanisms are for stress that they have, if they have any, and also just get an idea of their level of self-expectations, what their relationships are with others, including maybe teammates and coaches, any family history or history of anxiety. So all this information is really helpful for me when I try to, when I come up with my therapy plan, I try to help the patients out. It fosters a closer connection with the patient. And as I said before, no two patients are the same. So they may require, each patient requires just something a little different. I find there are little nuances that come up into my mind that I think, this person had XYZ and they experienced ABC. And so, I think I'm just going to switch the order of how I do things with that patient, or I'm going to have them do it this way, or think of it a little bit more like this. And all these little nuances are just, I find, so critical in effective treatment for VCD patients, because VCD it's a really complex disorder. I think it's more than just opening up the vocal cords. It's more than that. So that's the part that I like, is being able to delve in and help that patient. It really helps create a personalized approach.